Unit 2, Working in Health and Social Care. This PowerPoint continues from the PowerPoint you looked at last week, focusing on roles and responsibilities of people who work in health and social care. So we're just going to move on just to look at policies and procedures as well. So the key terms we'll be looking at in this PowerPoint in particular is policies, procedures and safeguarding. And at the end I've put an example of the question that has been set in the exam, in a past exam paper, and an answer. And also I've devised an up-to-date 2020 question for you to have a go at. As you know, if you work in health and social care, such as a nurse, doctor, healthcare assistant, social worker, you need to make sure that you follow all the policies and procedures that they have in place in those health and social care settings. Failure to do so will mean that you could be disciplined and even taken to court. So health and social care settings have guidelines that describe the working procedures that should be followed to ensure that the care that you provide actually meets the people's needs that you are looking after. They help to ensure that that you are within the law, so you're not breaking any laws, and to the highest professional standards. Safeguarding, this is used throughout the paper, is a term to describe protecting the health of others. In health and social care, you are safeguarding some of the most vulnerable people within society, especially those young children, the elderly, those with special needs. You are there to protect them from abuse, harm and neglect. So just to recap and refresh your memory, policies. A policy is a set of ideas or a plan of what to do in a particular situation. So they're like, it's there for you to refer to check, oh hang on, this is what I need to do in this particular situation. The specific policies in place at a care setting will vary depending where you work. For example, if you work at an old people's home, or whether you work in a children's home, or whether you work in a hospital, for example. So you could have a health and safety policy, equality and diversity policy, medication policy, safeguarding policy, disclosing and barring service. That's a DBS, that's to check to see whether any of the staff that work at the institution or setting has a criminal record. Death of a resident procedure, well that's not going to be in a school because it's not, you don't live in a school, well most people don't live within a school, and it's focused on the elderly. So again, it's linked to the actual setting. And a complaints policy. Every single setting should have a complaints policy in place. If you get the chance, if you could check the link here of an example of a death of a resident policy, you'll be able to see how much detail and depth actually goes into place of into actually writing a policy to make sure people are following it, following the plan properly, to make sure that everybody is covered, to make sure they don't actually get into trouble. The specification sort of moves on from here, so it's gone from policies and procedures to healing and supporting of people who are ill. So we will cover this, and then at the end we'll have a question that includes most of this content. There's lots of different strategies that people could use to support people who are ill, to help them in their recovery, and there is a range of treatment that could be used. For example, a doctor may prescribe medication to help support somebody who is ill. They may suggest surgery for somebody who has a faulty heart valve, radiotherapy for someone that has cancer, organ transplant for somebody who has kidney failure, for example, and supportive lifestyle changes, getting people to stop, or encouraging people to stop drinking, taking drugs, smoking, all of these factors that can affect health. In regards to prescribing medication, traditionally prescribing medication, writing prescriptions is a doctor's role. However, lots of nurses now undergo training whilst at university, or they're given training by their actual hospital or setting to actually to be able to prescribe medication. So for example, if you go to an asthma clinic, a nurse may be able to prescribe a change in inhaler. Nurses are also able, if they have the qualification, to hand out medication on a ward round in hospital. The only other people really that can prescribe medication are your dentists, chiropodists and physios, but they can only prescribe certain medications in certain circumstances. For example, if you have a gum infection, a dentist may be able to prescribe antibiotics. Surgery. Surgery is only ever required if the doctor or consultant feels that by giving you this particular approach, it will aid your recovery. For example, if you have a cancerous tumour that needs to be removed, you could have surgery. Surgery can help improve the lifestyle of many of our older generation. Lots of the elderly need hip replacements. Health and care workers can assist in post-surgery. They could change dressings, visit, treatments. Physiotherapists can also help with post-surgery, so they could give you exercise to help make particular muscles stronger after surgery and joints. Home workers may provide practical support at home, so they may come around and help cook you meals or prepare your meals. And community help is on hand after surgery, as hospitals tend to discharge patients very quickly after surgery. The reason that they do this is that the longer you are in hospital, the greater risk of infection. So if they can undertake surgery on you and then as quickly as possible release you, it means that you've got a greater chance of avoiding that infection. Radiotherapy. This treatment's used using high radiation and it's planned by skilled radiotherapists and trained nurses. It's not just used to treat cancer, it can actually be used to treat non-cancerous tumours that are growing and affecting particular parts of the body. Patients will need some support from their GP after these sessions. It has a massive impact on people who are going through this. They could have itching, blistering of the skin. It can be quite traumatic, and the fact that they're very tired, fatigued. There's actually a YouTube clip that you could watch if you need to refresh your memory on what radiotherapy is. Organ transplantation. This is something very close to my heart. It's about involving another body part or organ from one person's body to another. Now, this can be done from a deceased person, or it can be done from a live person. That will depend on what you're trying to transplant as well. So the whole purpose of a transplantation is to replace the patient's damaged or absent organ. There's only a few things really that can be transplanted. So kidney, heart, liver, lungs, pancreas and intestines. With a liver, you can transplant from another live person, as you don't often need the whole liver to be transplanted. Kidney, most people can survive on one kidney, so therefore if you have someone in need of a kidney transplant, someone from the family could donate their kidney to the person who has had both their kidneys failed. The most common transplant is kidneys and liver. A living donor, as I just said, can give one kidney, a part of the liver and some tissues such as bone marrow. But most organs are taken from a dead donor, but they've got to be the right match, and donor lists are huge. The donor waiting lists can mean that you are there for years and years and years waiting for a perfect match. So if more people are on that waiting list, it can mean that is cut down, and the government at the moment is working on an opt-out system. So you are on the list to donate your body to medicine or for transplantation unless you opt out. Unless people start doing this, more and more people who have, for example, kidney failure will start dying, and they still do. When you have an organ transplantation, you may need counselling after receiving a donor. If someone in your family is required to give a organ transplantation such as a kidney, they will also have to undergo counselling before and after as well. A highly skilled surgeon will carry out the transplant, but other staff will be involved in the preparation of the patient, both physically and mentally, for the operation. People who work with transplant patients after the operation include specialist nurses, physiotherapists, occupational therapists, counsellors and social workers. In regards to my family situation, for the people that have had organ transplantations, 9 years later they're still at hospital, still seeing specialists, phlebotomists to have their blood taken, consultants to check that their blood is good, blood results are good. Yeah, so it's actually quite a traumatic event, and it impacts your life. Well, it will impact your life until the organ fails again. Support for lifestyle changes. So lifestyle choices are: do you drink? Do you take drugs? Do you exercise? Do you eat well? We all know that eating well, exercising, not drinking, not smoking will actually be beneficial for our lives, but we make choices and we have these choices as to whether we decide that actually, do you know what, I'm going to have a drink, or I'm going to smoke. But changing those patterns and habits can and help improve somebody's health. If we don't smoke, we're not at such a high risk of getting lung cancer. If we exercise, we reduce our risk of obesity, for example. To help support people with lifestyle changes, for example, people who are obese, there might be counselling and self-help groups that can be vital in this role. We already have Slimming World and Weight Watchers to help with this side of things. GPs, practices, nurses and district nurses can help assist individuals to set up self-help groups. So if they decide, hang on, I'd like to set up a self-help group in my area, for example, of obesity or quitting smoking, they could help and assist them to do that. In society, we are really lucky that we can access support from specialist agencies. Many specialist agencies support and promote the health and wellbeing of service users. Healthcare professionals can inform the service users about these agencies. For example, Age UK. My nan uses Age UK a lot to get a list of gardeners, for example, that could help her maintain her garden. A list of people that can provide meals to the home so she doesn't have to cook. Mind provides advice and support for people with mental health problems and campaigns to raise awareness. They might be able to suggest where you could go to get particular help and support in your local area. Alzheimer's Society, it provides information and support for people living with dementia and their carers. They could provide support in the form of respite care. They might be able to suggest people that might be able to provide care in the local area to give you a break, for example. So here we are. I've popped another exam question in, and it is a case study of early years. You have been appointed to work as a healthcare assistant in a neonatal unit at Oak Trees Hospital. The unit has a procedure in place that states you should wear gloves. You should wear when changing what you should wear, when changing the babies, such as disposable gloves and an apron. Other guidelines give you information about how to disinfect surfaces and how to dispose of used nappies. You enjoy your work and learn by observing more experienced staff. However, you've noticed that some members of staff do not wash their hands after they've finished changing nappies. I want you to think back about health and safety policies. Quickly Google it if you need to, have an example of a health and safety policy in a hospital or even in a neonatal unit. Even have a little look at your revision guides. Describe 2 key objectives that Oak Trees Hospital health and safety policy should address. What should be in their health and social care policy? Now, before you move on to the next slides, which you know will have the answer, have a go at this to see whether you are on the right track or not. But again, you may look at your books, you may have a quick look at Google if you need to, but don't move on to the next slide until you at least jotted down a couple of ideas. So there are 4 marks up for this, and this will be the same on the last question I've given you as well. It'll be 4 marks. I don't think I said that on the last PowerPoint we did, but just bear in mind that it will be 4 marks. There's 1 mark per reason, and then 1 mark for an expansion. So you have to expand on what you've said. So for example, you could have put for a health and safety policy that risk assessments should be done and risks should be identified and managed. Now, if we look at going back to school in COVID-19, every single setting, every single school must have in place a risk assessment that is a COVID-19 risk assessment, and this risk assessment must be sent out to all staff, anyone who works in that setting, and all the risks of COVID-19 should be identified, and there should be an example of how it can be managed. So if you think about that one, risk assessment should be done and risks identified and managed for included in the health and safety policy, which if you think about it, is common sense. You're actually thinking about the health and safety through a risk assessment. You could also discuss about what should be in health and safety policy, such as any accidents, how they should be reported, and then any action that should be taken to reduce occurrence. So again, you mentioned the accidents, and then how to report those could be the expansion. Another example you could put is it reduces the incidence of accidents. The whole idea of having a health and safety policy is to reduce the amount of people getting hurt, therefore reducing the amount of complaints or compensation that people try to claim afterwards. So this is what the exam board recommend to put for this 4-mark answer. I've devised a question which is very similar to the one that I've just gone over here, but you will need to adapt it and link to the vocational scenario. So this exam question here is one that I've devised, obviously, because we haven't sat an exam this year, and it's linked to COVID-19. So you work as a nurse in a COVID-19 ward at East Surrey Hospital. You're expected to wear PPE, so protective equipment, like a face shield, mask, apron, gloves, and you must wash your hands regularly. However, you notice that one of your colleagues is not changing their gloves between patients, and this is a COVID-19 ward, so they've touched one person, not taken their gloves off and disposed of them, and then gone to touch another one. Explain 2 key objectives that should be included in the East Surrey COVID-19 health and safety policy. You can use the question to guide you before, but you must also link to the scenario and the current situation we find ourselves in. Good luck. For those who have kindly sent it to me last week, if you could also do the same, have a go, and then take a photograph of it, pop it on Instagram to me, or jot it down on a piece of paper. Again, photograph it, email it, or you could even, if you've typed it up, email it to me that way. Good luck, and there will be some exam questions coming your way shortly.